Federal Workforce Fallout is sponsored by Prince George's Community College.
You're watching Federal Workforce Fallout. Thanks for joining us. I'm Larry Miller. A new federal proposal could impact thousands of federal workers across our region. The Trump administration wants all federal employees to sign non-disclosure agreements. Lionel Donovan gets us up to speed.
The Office of Personnel Management released a draft of this proposal yesterday, and it's expected to go live today. It explicitly calls out multiple news organizations and tries to make the case that having federal workers leaking information to the press disrupts agency operations and erodes public trust. One example the draft uses is when several federal employees in both the FBI and DHS leaked information about planned immigration enforcement actions, which the draft argues endangered the lives of federal agents. The draft goes on to say that workers would still be protected under federal whistleblower laws, and they could still disclose waste, fraud, abuse, or misconduct. But some employment attorneys say NDAs for federal workers may stop whistleblowers in their tracks.
There's a lot of language in here that I could certainly see a person reading and being intimidated by. So I think it does have a bit of a chilling or silencing effect. I think people would be less likely after signing one of these to come forward and report wrongdoing at their agency.
Now, this rule will be officially published today, which triggers a 30-day public comment period. But even if this passes, it's not mandatory. Agencies would be able to decide whether or not to use the NDA. From the studio, Lionel Donovan, WUSA 9.
The federal government is turning to AI to speed up hiring. The U.S. Office of Personnel Management is expanding access to USA Class. The tool quickly creates job descriptions using AI. Officials say that it will reduce paperwork and streamline the process. Well, there are questions about how global health funds are being spent. Reporting from our partners at CNN suggests that the Trump administration is looking to divert $2 billion in global health funding to pay for the cost of shutting down USAID. The State Department did respond to our requests for questions about this issue and others. But for several weeks prior to this reporting, they told us in an interview that the department will continue working with Congress to implement appropriated funds consistent with the law and President Trump's America First global health strategy. Dr. K-Jean Sung is a drug-resistant TB expert, an outbreak investigator, and HIV/AIDS physician. He says that only a small amount of money allocated and obligated for global health by Congress is actually being spent, which he says raises concerns. Doc, I wanted to sort of get your assessment about where PEPFAR funding stands now. You know, based on what you publish, there seems to be some real concerns that you have about sort of the implementation of, well, first of all, the transfer of money from the State Department to the CDC, and then two, how that money is now getting to clinics, NGOs, and other organizations that depend on it for them to deliver appropriate care to those that need it.
Yeah, and it's not so much about the total amount of money, right? Mm-hmm. Because we know that Congress has appropriated the same amount of global health money that it did last year in 2025, that it did the year in 2024. And that's because all of global health is really important to Congress, and certainly HIV/AIDS health money, which is PEPFAR. So that has remained completely constant. So it's really about how that money is being spent. And that is what is just incredibly confusing. You know, the State Department, which is responsible for all of it, is not been very transparent. And we don't know, is that intentional or is it actually just real confusion on their side too? They may also not really know exactly what the plan is or what they should be doing. But yeah, I mean, just from stepping back a bit, I think that has caused a lot of confusion on the ground with all of these NGOs that have been working to provide HIV/AIDS care. And I think you're going to see that in Botswana, South Africa, all these countries. I think they will all report that it's a lot more confusing than it has been in the past.
There is reporting that suggests that the administration is sort of leveraging PEPFAR funding as a means of trying to get access, either intellectual or even physical access to some of these countries, maybe in the way of mineral rights or in the way of data that previously wasn't required under last sort of memorandums of understanding. What is your understanding of that situation itself and sort of the implications as a result of that?
Right. So I think that the old model was that global health, when you're trying to treat people with deadly diseases like HIV, that's just not supposed to be political. It's complete. It was really put in its own track, and really that was one of the reasons, I think, one of the rationale for USAID being a different agency. It was obviously part of the State Department, but it was kind of doing its own thing. But now I think all bets are off, right? They've destroyed that platform partially. Like they dismantled USAID. It looks like they're trying to dismantle CDC, the CDC portion of that global health platform. They haven't done it yet, but I think I can guess that's partly that it's the same sort of intention to destroy what went on before, and we're going to create something new. And I think that the reporting has been very, very accurate. They're trying to figure out what the new way of doing global health is going to be. And they are trying to set up they're trying to negotiate with all of these different governments. It has been very clear, that it is transactional. And the Zambia contract that was just signed, yeah, it was just very, very clear. This needs, and it's there in black and white in the MOU that mineral rights is on the table, and that needs to be clarified before the global health money can flow. So I think the reporting, no matter what the State Department is saying or denying, I don't know. I mean, it's right there in black and white in this contract that they're negotiating and that are being signed.
And for you, and based on the research that you've conducted thus far and your analysis, what sort of risk does this pose to those countries that are still grappling with trying to control and even help prevent new cases of HIV?
Yeah. Well, when you have disruptions like this, for example, I think the piece that I wrote was specifically about the CDC part of PEPFAR. But that was only one half. The other half was the USAID half, and that was completely dismantled. So whenever you have a major disruption like that, when you just terminate all the funding flows to all of these small NGOs, some of them American NGOs, but a lot of them African NGOs, they have to shut down. They have to stop their activities. They have to lay off people. They have to look for funding elsewhere, and it may not come. And even if it comes, it's hard to hire those people back that you just fired. So this really does end up, in healthcare. If you can't just stop providing healthcare in a clinic for a day or a week or a month, you are not providing life-saving services, and that ends up hurting people's health and resulting in some deaths.
The Trump administration has been on a mission to effectively end DEI as we know it. That's diversity, equity, and inclusion. But is it possible? We're going to have more on that next. Welcome back to Federal Workforce Fallout. The Trump administration set out on a mission in early 2025 to end DEI, diversity, equity, and inclusion. They've cut programs considered to be forms of DEI, but is it really gone for good? I spoke with Dr. Vanessa Weaver. She's the CEO of Alignment Strategies. She provided some insight. A lot that's been going on since the last time we've spoken. And one of the big things that's come up, particularly around the federal workforce, has been not just with the number of Black women that have lost their jobs, but sort of the way in which DEI now has fundamentally changed as a result of the Trump administration's really ongoing efforts to dismantle and change the way in which
DEI's approach. Now, the administration says that they are anti-DEI, diversity, equity, and inclusion, because they say that it is unfair and discriminatory against certain groups of people that are sort of left out of that conversation. And they are now promoting and consistently talking about meritocracy as they see it, people being able to advance on their merits. You deal specifically in the DEI space. That is sort of a specialty for you. Walk me through sort of, now that we are in, it's been a year since we've seen sort of the first round of cuts from the Trump administration in the federal workforce. Walk me through how DEI has changed.
Okay. Well, I was thinking, Larry, for those of our viewers that might not be familiar with DEI, maybe I'll just do a quick description of what that means.
Yes, ma'am.
Okay. So the DEI, the D stands for differences. And you think about that in terms of all the differences we have, whether they be gender differences, sexual orientation, age, race, religion. So it speaks to all the differences that individuals bring to the workplace. And that's important because the belief is that those differences really expand our thinking around how to approach issues on the job and develop or identify solutions for it. So D stands for differences. The E is around equity, and equity is all about fairness. Are people, in fact, being compensated fairly for the roles that they're playing? Are they being recognized for the contributions that they're making? Are they getting a shot to even have particular jobs? And, before the introduction of that, there was a disparity in terms of the kinds of roles that women, LGBTQ people, people ages of a certain age could get. And so equity is about fairness. So think about that in terms of fairness. And frankly, that's really the big rub with DEI, because the contention is that the equity part excludes other people because they don't get a chance to apply for those roles and positions and whatever. And then I would tell you the data does not support that at all. In any industry, it doesn't support it. And then the I stands for inclusion. And that's really the secret sauce and all this stuff, because if you have people if you just bring people in because they're different, but you haven't figured out how to get them to work together, to feel included, to feel part of an organization, then you really are not going to optimize the diversity that they bring. So that's what DEI stands for. So you asked the question, what's happened in the last year? It has been tumultuous. And really it's been the last 2 years, because before Trump, the Trump administration issued their executive orders against DEI in the federal government jobs, they had already started really going at private sector companies and really inquiring about their DEI programs, going to their board meetings, and really creating a lot of tension around this. And so this whole anti-DEI thing has been going on since about 2022, 2023. But in terms of what's happened in the last year, it has been pretty disastrous. DEI is not eliminated, it's not dead, but let me say it's on life support. And in every category, it's been pretty significant. If you look at just the promotion rates of women, particularly white women, who lead in the promotion of any other race of women, they are almost plateaued. And it struck me at the presidential State of the Union address when the president said, we've eliminated DEI, how many women stood up in the Congress and applauded that. And I was thinking, they just don't even understand the impact of this on themselves, on their daughters, on their sisters, on women that vote for them. It's been pretty significant. So there's been a significant plateauing in terms of the number of women, particularly white women, who are getting promoted into senior level, executive level jobs. It's stalled. And for women of color, and I'm defining women of color as Black, Latina, particularly Black and Latina, it's already been so much lower than white women. It is almost non-eligible. I mean, you just don't even know that it's existing. It has not only stalled, it has declined something like 30 to 40%. And so the promotion rate for women overall, and particularly women of color, it has been disastrous. For people who are a senior in the workplace, and elder seniors, I'm talking about people who are 60 and over, who are still in the workplace, there's been a reduction in the number of jobs that elderly, what I'm calling the seasoned grown-ups, that they've been able to take. It takes them 2 to 3 times longer to find a job than any other cohort group. And for women, it's even longer than that. So there's a bias, and they call it the intersectionality between uh, two components. And so this would say age and gender is a significant impact. When you look at government contracting, and that's so important because the government several decades ago instituted what they call 8A programs. And those programs were designed to make sure that women, the multicultural individuals, that people with disabilities, seniors had an equal shot, or at least a fair shot at getting government contracts. And so that program has not been eliminated, but again, it's stalled and it's taken longer to go through the application procedure. There's although there's not an elimination, there's been a reluctance to advance those applications forward. And so there's been an impact in that way. For LGBTQ communities, particularly LGBTQ people who are people of color, they are having increases in what they call harassment complaints with EEO in terms of how they're being treated on the job. Some of the protections that were afforded them that people feel are not in place yet or not in place anymore. They are really, experiencing more and more on the job harassment. And so in almost all the sectors, it's been a decrease. Minimally, it's stalled, but in most situations, it's been a decrease. And it's not different in the private sector. We think it's just the federal government. No. In the private sector, those companies that had formal DEI programs, about 70% of them eliminated it. Now, they might say they called it something else or, but a duck by a duck is just a duck. And so they renamed it, or most of them have eliminated it. And so there have been a lot of then women, people of color that were heading many of those DEI organizations, they've lost their jobs. As you know, we've talked about it on this program. Over 300,000 Black women lost their jobs in the last year. And so it's just been a tremendous impact. And I know I'm just like talking because this is something I'm so passionate about. But I would tell you that in terms of business impact, we know from the data and from research that organizations that invest in DEI have higher productivities rates, they have higher earning potential, they have better teaming. It has positively impacted the workplace. And so now that that's been stalled or people are not focused on it, you can only imagine the productivity or lack of in our American workforce.
Dr. Weaver, the Trump administration and other critics of DEI have suggested that DEI was inherently discriminatory, particularly against white Americans in many respects.
Mm-hmm.
Based on your field of study, based on the things that you have done in this space, what are the weaknesses of DEI? Has DEI to some extent been discriminatory against white Americans or other groups?
Well, I know that that's been the consistent argument, but the data just does not support it. Even with the inclusion or the expansion of DEI programs, white males still had the majority of promotions at all levels. This is from entry level to executive levels. So that white men, although they say that they were disenfranchised and did not have the same opportunities, the data just does not support that. And I will tell you that in terms of the DEI space, the group that has been most advantaged with DEI has been white women. And so they lead all diversity cohorts around promotion, around sponsorship, around inclusion in their workplaces. And so it really doesn't, the data doesn't support it. And it's interesting because there was one of the Doge people were confronted because they were saying we're anti-DI, we're turning DI up. And when they asked them, well, what is it? They couldn't even define or understand what it is they were tearing up. And so it's been a lot of misinformation, unfortunately, about DEI. And I can tell you that in those organizations that have been committed to DEI for decades, it has been beneficial to everyone because it really is about creating a workplace culture that is inclusive, where people feel that they can be heard, that their ideas can be vetted, that they can be themselves, that they don't have to conform to a point of being like another group in order to be successful. And so, that argument just doesn't carry any weight when you get beyond the emotional piece of it. What we do know is that most people don't really want to take the time, invest the time in terms of digging, into the information to find out, well, how true is this? But I would tell you that it's just not the data just does not support it.
Did you find at any point in time that there were some inherent weaknesses of DEI? In other words, were there areas where DEI could have made greater improvements that potentially could have had DEI as we know it sort of looked at favorably amongst those that are some of its harshest critics?
Well, that is a great question. I think in any discipline, in any arena, there should be room for improvement. And I would clearly say that for DEI. I think that one of the areas that I feel was weakest about DEI was the inability of us to clearly translate to the everyday person why DEI was in their benefit. I mean, at the end of the day, we go to work and we make contributions because it makes sense for us, it makes sense for the organization, but definitely makes sense for us. We call it the self-interest principle. And I don't think we always were clear to help people understand, well, why is it in your self-interest? How is DEI helping you? And to really have some very clear conversations. And then in other areas, I think we could have done a better job. We often reduce DEI to activities, like you have 1 month you would have Black Cookout Month, and then the other month you would have Hispanic Month, and it would be, these activities. And so in many people's eyes, it got to be much more of a social effort than it was really one that really drove business results. And I think that in my profession, particularly the professionals at DEI, we should have been a lot more disciplined in terms of establishing what is the business case for this. Why does this make business sense for the organization to invest in DEI, to practice DEI? And I don't know that we were always disciplined enough in advancing that business case.
How concerned are you about what the future of DEI will look like moving forward? I mean, the Trump administration still has several more years in office. And you said that DEI is currently on life support. If it's on life support now, what do you think the future looks like for DEI?
Well, I think it's very challenging. And I think it is going to require, I know it's going to require people speaking up that have benefited from DEI, where their businesses have turned around, for them to start putting voice to this. Because unfortunately, what happened is that when the current administration went the anti-DEI route, a lot of people just folded, and there wasn't really a pushback, an organized, concerted pushback on what has been the benefits of DEI to the business and to themselves. So I think people's voices are going to have to be here. And it's going to be important because not only is it important for someone like myself, who clearly I'm a Black female, but my children, my grandchildren, other people's children and their grandchildren, is going to be really important. I can tell you that in the early days of DEI, when we were just introducing the whole thing around women, what made it change and really connect with many white males is that they had daughters. Many of their daughters were going to college and taking, their first jobs. And so they would hear their daughters talk about the kind of experiences they had, the kind of discrimination that they were facing. And it really rang a bell. And many of the men would tell me, you know what, I didn't get it until my daughter began to talk to me about what she's experiencing. And so if people can personalize, we can help people personalize the benefits and also the impact to people that we care about when there isn't fairness and equity in the organization, when there isn't an attempt to really have people become more inclusive. If people could really understand that, I think that would be the game changer that we need.
Our thanks to Dr. Weaver. You can count on WUSA 9 to stay on top of the reductions to the workforce, those affected, and what it means for our community. In the meantime, scan the QR code on your screen. It will take you to a special section of WUSA9.com dedicated to our coverage of this story. And of course, we'll keep you updated right here on federal workforce fallout. We appreciate you being here. Take care, and we'll see you again soon.
You've learned a lot in life, on the job, in the military, raising a family. At Prince George's Community College, that experience can count as college credit. You could earn up to 15 college credits towards your degree just for what you already know. Eligible Prince George's County grads can even attend tuition-free with the Promise Scholarship. So, what's your game plan? Turn your journey into a degree at Prince George's Community College.